we can start with the conference if you agree. And please mute yourself before I give the floor to the people. Good afternoon and good morning, ladies and gentlemen. Welcome to the conference Exploring Violence Against Older Women. My name is Nataša Todorović from the Red Cross of Serbia, and I'm the representative of INPEA for Europe. I'm here in dual role. Today, I will be hosting the conference, and also as the part of the team working on the study, I will be presenting the recommendation later on. Today, we live in an era where life expectancy has increased, people live longer, and what certain characteristic this era is the feminization of aging. Women live longer, but also happens that they live in poorer material condition or live in poorer health. Also, we need to remember, you are not a blank slate at the age of 65, and there are many inequalities and problems accumulating over the lifetime. This study tries to ensure that we look at the woman's life from the perspective of a life course. That we look at older women not as an homogeneous group, but a group where its members are significantly different from each other, and that we pay special attention to older women at increased risk of violence. It is important that the problem of violence against older women is mainstreaming into the society, not only within the discourse of violence against older person, but also in a gender-based violence discourse. Mainstreaming primarily means that we need to think beyond a chronological age, so all the age cutoffs, whether at the age of 49, 59 or 74 need to be abandoned, because the data such studies provide are incomplete and do not adequately respond to the experience of violence of older women. This project is a good example of cooperation through various projects. It starts as a project funded by European Union and Austrian Development Agency only in Serbia and Austria, and with qualitative data. Then it was expanded thanks to the cooperation with OSCE, so a quantitative research for the Serbia, and we could be done, and finally, thanks to the UNFPA support, it was expanded to become a regional research project. Therefore, I will now give the floor to Dr. Gabriela Alvarez-Minte, Regional Gender Advisor, UNFPA Regional Office for Eastern Europe and Central Asia. Mrs. Minte, floor is yours.
Thank you so much. I suppose you can hear me. Can you just nod if you can hear me? Yes, Borka is smiling, so she can hear me. So, dear friends and dear colleagues, thank you so much for the opportunity to speak in this incredibly interesting event. I will start with a reflection, and I probably don't need to convince you that gender-based violence is one of the most prevalent human rights violations today. We know that it slows down development and has significant social, human, and economic cost. We know that in times of crisis, violence tends to increase and become more extreme. As the COVID-19 pandemic has hit us, we have witnessed an increase in violence. UNFPA estimated that for every 3 months of lockdown, an additional 15 million cases of gender-based violence were expected globally. But these things we know, there are many things that we don't know. And this is what this event is about, to help us uncover the complex way in which gender-based violence affect different groups. Understanding and addressing gender-based violence against older women requires us to recognize with humility that we have neglected it. It has been largely unaddressed. Too many surveys have not collected the data, and we have not developed the conceptual tools to analyze it. And these unanswered questions have left us with gaps. To what extent are older women's vulnerability to violence linked to issues associated with aging? How does power dynamics, exclusion, and marginalization of older women manifest in different forms of gender-based violence? How is gender-based violence manifested along the whole life of women, but also of men? These are big questions, and we will not be able to answer all of them today, but we will start in a journey to respond them. To start, as UNFPA, we thrive to design initiatives with evidence and data. Only by having the evidence and the data will we know the magnitude of the problem, have a better understanding of where it happens, to whom, and sometimes even why. With good data, we can also understand the scale of gender-based violence and the impact in the life of older women, but also women living with disability, women living with HIV/AIDS, minorities, etc. And based on this data, we can design better and more sustainable interventions. We do this with the knowledge that women are victims of gender-based violence throughout their life. And this is consequence of the same unequal power relations between men and women, adults and children, as well as the entrenched exclusion and discrimination of women and girls, and particularly older women. It is based on attitudes, norms, structures, and social practices that undermine women and consider them of less status than men. Therefore, any effort to eliminate gender-based violence against older women must seek profound change to create more gender equalitarian and non-violent societies, and societies without stigma against older people. We must envision societies where women and girls of all ages do not have to see their rights restricted and their safety and emotional integrity and even their lives threatened. As the United Nations Population Agency, we have gender equality and women and girls' rights at the core of our work. And we aim to transform fundamentally unequal power structures and relations. We want to ensure that women and girls can exercise bodily autonomy and enjoy their rights and access to opportunities free from discrimination, exclusion, and violence throughout their lives. So we're here to learn, and I'm personally looking forward to hear the expert. This is not only a contribution to the body of evidence on gender-based violence in the region in general, but it will be key to inform our interventions and protect older women's rights to a life free of violence. Thank you so much, and I'm looking forward to hear the rest of the panelists.
Thank you, Ms. Ninte, for this comprehensive statement. And now, today with us is Ms. Borka Jeremic, Assistant Representative Head of Office, UNFPA Country Office, Serbia. Ms. Jeremic, the floor is yours.
Thank you, Natasha. Dear colleagues and friends, it is really a great pleasure to be here today and discuss the results research for Serbia and the Western Balkans region, Moldova and Ukraine on violence against older women and their empowerment. I would like to greet you all on behalf of UNFPA country office in Serbia, and I would also like to extend greetings from our country director, Mr. John Mossotti, who is traveling today and was not able to be with us online, but he's sending his greetings and appreciates very much this event. I would also like to particularly thank our colleagues from the regional office and extend our special thanks for their support to this initiative. I would also like to express appreciation for today's participation to our colleagues from country offices in Eastern Europe and Central Asia region, and to thank particularly those who have provided contribution to making this research possible. I would also like to welcome Madame Claudia Mahler, who is today with us, and she will give her special point of view related to human rights angle to contextualize our today's discussion accordingly. And also, I would like to mention and say special thanks to our colleagues from the Red Cross of Serbia, to the researchers, Madame Babovic and Madame Brownell, who did conduct this analysis. It is also very important, and we are very proud of it, that this research was done in consultation and collaboration with OSCE, because we use their data on different forms of violence that women experience in their childhood and throughout their lives as a basis for this research. So we thank OSCE for the great cooperation and look forward to new similar opportunities in the future. I would like also to mention three main reasons why this research is so important for UNFPA. First, it helps us improve the understanding of prevalence and risks related to violence and abuse targeting older women in Serbia and other countries and territories of the region, including Moldova and Ukraine, and to observe patterns related to specific forms of violence and the related specific risks. Second reason is because this research identifies and highlights gaps and systemic gaps in general, so that we can understand better the violence targeting women, which often tend to exclude some of the most vulnerable groups, such as older women. And finally, it provides some good evidence-based recommendations for further in-depth analysis to increase intersectoral understanding of the abuse against older women in Serbia and other countries and territories in the region. Gender-based violence undermines the health, dignity, security, and autonomy of its victims, and it has consequences on both the physical and mental and sexual and reproductive health, including unintended and unwanted pregnancies, unsafe abortions, sexually transmitted infections, including HIV, and even death. However, most research and existing evidence focuses on women during their reproductive age, leaving older women in the shadow. This study analyzed precisely the available data on violence against older women, although there is very little data, we know it, and contributed to capturing the main patterns in several countries and territories in the Western Balkans region and Eastern Europe and Central Asia. The analysis that we present today show that elder abuse is a complex phenomenon with a pronounced gender component. Older persons are in most research and data collection activities treated as homogeneous whole group with little to no accounting for age and gender. The World Health Organization's data show that only 1 in 24 cases of elder abuse gets reported, and the official statistics is just the tip in the iceberg. While elder abuse in general is underreported and under-researched, violence targeting older women is even more so. Also, most health-related data on women has a cutoff point at the age of 49, so most research done on elder abuse fails to identify key risk factors and prevention methods that are specific to older women. Violence against women in Serbia is also of significant concern. It knows no social, economic, or national boundaries. Gender inequalities are persistent in the entire region, and there are deep-rooted stereotypes about the roles of women and men in family and society. Without going into details of the research itself, which my colleagues will present later today, let me mention one fact that shows that 16.7% of women over the age of 65 have experienced violence in the past 12 months. For many of them, this is a continuation of the violence they have suffered during their lives. This data should be a warning for all of us and decision makers to get involved and review the current legal solutions. In the past 5 years, with our partners, UNFPA conducted several types of research on women living in conditions such as rural areas, then research on violence against older people, then assessment on digital inclusion of older people. Then we did some research on impact of COVID-19 on older people. We also looked into the mental health of informal caregivers in cooperation with the Red Cross of Serbia. Using the evidence that we have collected so far, including this report that we are discussing today, we plan to continue our efforts to give visibility to the rights and needs of older persons, including our special focus on healthy aging and promoting intergenerational solidarity. We have developed a call for action in combating ageism in Serbia that will help us address the ageism in all of its forms, including those that are described in this report. Ageism is a widespread form of prejudice and discrimination, and it affects the population on many levels. It affects directly physical and mental health of older persons, and it also influences policy making that oftentimes overlooks the heterogeneous nature of the older population and their needs, interests, and capacities. I would like to indicate a very positive practice that we have had in Serbia last year. As an integrated response to violence against women, UN Women, UNDP, and UNFPA, in close collaboration with the Ministry of Labor, Employment, Veteran and Social Affairs and the Coordination Body for Gender Equality, have drafted a new strategy for preventing and responding to violence against women for the period 2021-2025. All our efforts go toward empowering women and abolishing harmful practices of violence and the rights of older persons that were taken into consideration in this important document. We believe that the results of this research will be valuable and will inspire normative proposals and future in-depth analysis on better understanding the prevalence and risk related to violence and abuse targeting older women. With this, I would close my introductory remarks, and I'm really looking forward to hearing the results of this excellent study. Thank you very much.
Thank you, Ms. Jeremic, and thank you to UNFPA. This research is done only because of the support of UNFPA. And now we are very happy that today with us is Dr. Claudia Mahler, the independent expert on the enjoyment of all human rights by older persons. We want to thank the Dr. Mahler for accepting our invitation at very short notice, we know that, and preparing a short statement drawing attention to the human rights of older women. Thank you, and floor is yours.
Thank you, Natasha, and thank you, the organizers, for inviting me to this very important event. And let me first start to wishing you all a happy new year, and I hope it's a good year for older persons and especially for older women. I would also like once again to say that I really think this is very important that we speak about elder abuse with a special focus on older women. And it is really of great importance to show this once again because older women are left behind. We see this in different sections, especially when we also check the United Nations system. For example, the Plan for Action for the Secretary General overlooks older persons, or UN Women doesn't have a specific focus on older women. Why is this so? Because there is no specific focus here. I'm the only UN expert with a real focus on the human rights of older women and of older persons, and there is no specific treaty, and this is also why there is no focus in different other areas. The intersectionality of gender and age is also accelerating their vulnerability. We heard this already. This is why I also dedicated my last year's report, which I presented to the General Assembly, to older women and the intersectionality of gender and age, where I also included a section on violence against older women and missing data. You can also find these intersectionalities in my report on ageism, where I clearly state that ageism and sexism accelerate each other and make older women more vulnerable than other groups. You can find these reports under my homepage and under the section of annual report if you're interested in. We all know that violence, abuse, and neglect of older women is a reality around the world, but it's very seldom discussed because it's still a taboo. One of these key obstacles in developing robust data, as we already heard, is the very high level of underreporting of elder abuse and abuse of older women in particular. Nobody really knows where to go to report this. And according to WHO, underreporting of elder abuse can reach up to 80% of all cases worldwide. We need to double our efforts to come up with potential countermeasures. But as long as under-detection and under-reporting and the lack of statistics and data is still a reality, we are still on the steps of awareness raising. And this is why this conference and the studies like this ones we are discussing today are key. Without data and statistics, we cannot develop concrete solution-based approaches, and the enjoyment of all or of many human rights of older women are at stake. From my point of view, it is equally important to examine the different forms of violence and abuse of older persons in various settings, taking into account the gender perspective. The types of abuse cited also from WHO, physical, psychological, sexual, and financial, are relatively similar across the member states. But we also know that there are some particular cases, for example, the abuse under drugs, the drug sedation of older persons under the category of chemical abuse. It's more seen in Western parts, or other accuses like violence and property grabbing. It's also in different parts of the world, more in the South. It's very often reported, or it was reported when I asked for contributions for my report from the Southern world of Africa. And other things, as older women have been identified in the open-ended working group on aging, where we discuss each year specific key issues from a human rights-based approach. There, all the stakeholders has identified older women as the most vulnerable to abuse and increasing with age. Older indigenous peoples or older women in rural and remote areas, and older LGBTI were also added to the list of particularly vulnerable to abuse. These examples show the diversity of older women and the intersectionality, which is key, as we said already. And this needs to be taken into account when we try to find ways to combat violence, abuse, and neglect. Those who are homebound and dependent on intermediaries for care have also been mentioned as the ones who are most at risk. It is a power-related factor, as we all know. I have also learned that financial abuse is on the rise worldwide. Abusers are family members, close friends, and caregivers, with financial abuse committed both by family and community members, as well as scam artists, and as a result of unethical business practices. As we already said, property grabbing abuse depends also very much on the level of protection provided by law. This is true for all the different aspects of violence. A few countries have legislation which is specifically addressing abuse and violence against older persons. But many countries only have legislation on violence and abuse against women or family violence prevention, which does not explicitly mention older women and does not take into account the increase in old age. Clearly, this legislation only covers issues within family settings or among those sharing a household, albeit some have added amendments on elder abuse, and there are many questions as to whether domestic violence legislation adequately prevents or follows up on elder abuse. These are still questions for the national level. As said before, from my view, data on experience of violence, abuse, maltreatment, neglect in later life is largely missing. Demographic and healthy surveys, despite their potential for filling informational gaps, typically exclude from their remit women aged 50 and over. We already heard this from Borka. and men aged 55 or 60 and over, for instance. Abuse of older women therefore remains largely invisible. This has wide repercussions, and these data sets form the basis for reporting on progress in the context of the implementation of the Sustainable Development Goal 5 in regard to violence against women would also be key. Therefore, I would recommend that states should constantly conduct research and studies and collect age and gender disaggregated data on abuse and violence against older women in and out care settings in order to assess the current situation and take appropriate measures to tackle elder abuse with a gender perspective. We also need to overcome the silos of discussion and collaborate more to strengthen the human rights for older persons, especially older women. From my point of view, a human rights convention with a specific focus on the rights of older persons would provide the best protection. But to achieve this goal, we have to raise awareness still and lobby powerfully for the protection on the national and international level and keep showing that there are still gaps there, protection gaps. We have to provide good and bad practices to show the significant difference a binding legal instrument would provide. If you need more arguments on this, please check my reports and also check the OHCHR analytical update paper from 2000-2001. I hope to hear older persons, especially older women, to stand up for their rights. It is an investment in all of our future, and we want to hear your voices in the next open-ended working group on aging, which is now open for calls of contribution, the 12th session, where we really need your voices. And I would also like to invite you to join me in my reports if you have the time to participate. Please also keep in mind that the next session will work on the SDGs and the participation of older persons in this regard. SDG 5, which would be an entry point for all of us to bring information on violence against older women. I thank you for your attention, and I'm really looking forward to more discussions on this issue.
Thank you, Ms. Mauer, very much for your intervention and for your statement. And because you participate in this conference, human rights of older women, it's crucial for the dignity of life in old age. Now we are going to present the research study result, and Professor Patricia Brownwald from Fordham University in New York will be setting the stage and presenting the main concept of violence against older women. Patricia, floor is yours.
Well, I'm so appreciative to be invited to this. This is such an important conference and topic, and something that many of us have been working on for quite a long time. I'm going to talk about the research on violence against women, specifically on the background and a little bit on the context. I'm not going to spend a lot of time talking about the researchers. I'm citing studies, but not going into detail. And I have prepared a reference sheet for anyone who is interested. Next slide, please. So focusing on data on neglect, abuse, and violence against older women, VAOW, we know this is an acknowledged gap, and we've known this for some time. In November 2013, the United Nations Department of Economic and Social Affairs hosted an expert group meeting in New York City. The purpose was to identify research on this topic, and specifically focus on international prevalence data. Attendees included Amal Rafe, and I know, Amal, you're on listening to this now, and you are now chief of the Program on Aging unit of the UNDESA in New York City. Natasha and Milutin, both from the Red Cross of Serbia, Susan Summers, INPEA, myself, Fordham University, Bridget Penhale, now Reader Emerita, University of East Anglia, UK, and others. And the most prominent gap identified was the lack of international prevalence data on violence against older women that could better inform governments, policymakers, service providers, planners, and the general public. Next slide, please. So we know at that time, no single prevalence rate for VAOW internationally was available based on existing research at that time. Instead, a diversity of prevalence studies were identified depending on, in part on the region or the location where the study was done, and also on the value frame within which the study was conducted. And these include, in terms of the value frames, violence against women or VAW prevalence studies. And I'm going to give one example for each of these categories. And an example at that time was the 2005 multi-country study on women's health and domestic violence against women that were conducted by the World Health Organization. And the findings didn't include any prevalence data on older women because no women over the age of 49 were included in the study sample. A second category identified was the, I call it the active, this is Bridget Penhale's term, the active aging prevalence studies. And there were none that only one that we could find that, and it was an excellent one. It's a multi-country study that exclusively focused on older women aged 60 years and older. And this was the prevalence study on abuse and violence against older women, results of a multicultural survey. And the study findings were published in 2011. And this is a European multinational study undertaken as part of the Daphne project. Survey questions were formulated for this stage of the life course, and the study found a very high prevalence rate. Next slide, please. The third category we identified was the vulnerable older adult, which tend to be a gender neutral category. An example of a multinational study on vulnerable older adults, including those in care homes and or within home care, is the European report on preventing maltreatment of older adults, also conducted by WHO in Europe, published in 2011. And it's comprehensive in its overview of ways in which older adults, including older women, are vulnerable to abuse and neglect, but reports prevalence data from multiple studies without adding to this knowledge base. And just as a caveat, vulnerable older adults in care homes and other institutional settings are very difficult to survey because institutional review boards, or IRBs, that are responsible for protection of human subjects require proof of informed consent. And also residential care facilities may not provide access to researchers. So in no way is this a criticism of this excellent report to say that they don't have the prevalence data for this subpopulation of older women. Next slide, please. So what were the gaps identified and recommendations made from the expert group meeting? One, there was a need to identify a single international prevalence rate for violence against older women while acknowledging differences among countries and regions. There was a need to focus on those countries and regions for which community prevalence studies have not been conducted. There was a need to promote a life course perspective on violence against older women. And there was a need to address barriers to obtaining prevalence data on older women, particularly those deemed most vulnerable to violence. And again, as a caveat, most older women, particularly those who live in the community, are not vulnerable to the extent that they can't participate in families, community, and their communities, and also in research surveys. Next slide, please. So what are some of the advances since the expert group meeting on prevalence research on violence against older women? The World Health Organization, and these particularly researchers, Jan and Carmen Garcia Moreno, utilize novel research techniques with advanced statistical methods like meta-analyses for estimating violence prevalence of older women globally, vulnerable older adults in residential care settings, and life course prevalence of violence against older women. And here in 2019, Jan et al. Published findings of a study that found a violence prevalence rate of 14.1% in the past year for older women globally. And Garcia Moreno found an over 20% lifetime prevalence rate for older women 65 years and older globally. This was published in 2013. Next slide, please. What are some of the innovations of the OSCE study on violence against women that make it so important for this topic of violence against older women and prevalence? First, it includes a sample of older women, this is up to age 74, which allows for comparison among women of all ages. Second, it includes questions on child abuse experienced by the adult study subjects, including older women subjects. This allows for correlations between child abuse and elder abuse, an emerging area of interest building on the findings of the Adverse Children's Experience Studies, or ACEs, that conducted by Kaiser Permanente in California. And national elder abuse prevalence researchers have noted similar correlations, as have USA researchers on using longitudinal data. And I have more information on this reference sheet on those studies. Next slide, please. So just a word about violence against women prevalence studies and a look ahead to the violence against older women study that we're learning about today. First, multi-country violence against women community prevalence studies are expensive, difficult, and time-consuming to undertake. And by including older women in the study sample and including questions about violence across the life course, OSCE made possible the secondary analysis that informs us on violence prevalence against older women and life course comparisons. Next slide, please. Just again, words about the OSCE study on well-being of women. This study was conducted on violence against women in selected countries in the Balkan area and contiguous countries. And it found prevalence data in a part of the world that has not been surveyed. This study extends research on violence against older women by including older women in the study sample. It sheds important light on prevalence, forms of abuse, and impact of violence on women of all ages. And importantly, it provides data for analysis on violence specifically experienced by older women in this region of the world. Next slide, please. So what are some next steps in violence against women that include violence against older women prevalence research? And I would suggest that adding questions and probes to the surveys that are specific to older people would be important. And I just want to highlight three categories. One is financial and material abuse. The violence against women studies assume the woman subject of reproductive age has young children and is dependent on the male spouse partner for financial and material support. These categories typically subsume financial abuse under the psychological violence category. However, this is a different kind of risk factor for older women who may be financially and materially independent, but are supporting adult children and other family members who are dependent on them for support, or who have ageist notions of entitlement. And older women can also be targeted by scammers, con artists, and what we call in the field of elder abuse, new best friends under non-partner violence. So these would be an example of some questions that could be added to a sample that would help us learn more about prevalence of violence against older women. Next slide, please. The second is neglect. And most older people, including older women, are independent and contribute to the well-being of their families and communities. However, some may have health and other conditions that require they receive assistance to remain in their homes and communities. These older women, particularly when suffering from chronic non-communicative diseases like arthritis, diabetes, and other infirmities associated with age, may need assistance from family members and other caregivers. And when their designated caregivers are unwilling or unable to provide needed care, older people, and as older women in particular, can suffer dire consequences. So questions or a question and prompts for this category of abuse could be included in prevalence studies on violence against women of all ages. Next slide, please. And final category and questions and prompts that could be useful related to perpetrators are that sadly adult women and adult children and grandchildren can be perpetrators of violence and against older women. So questions and prompts that encourage older women subjects to speak to this could also help to obtain a more accurate prevalence rate for this population. And just as an aside, the fact that adult children and even grandchildren are perpetrators of violence can be extremely painful for older women. And questions about this need to be approached with great care and sensitivity by interviewers. Specialized training for interviewers is recommended. And as with surveys on all forms of domestic violence, interviewers should conduct interviews in private with older women when they live in multifamily households. And there has been some novel framing of this issue, and Judy Smith, who's from my university, has just written a book on this, and I've just cited this in the reference section. Next slide, please. So focusing now, and I know the next part of our program will be focusing on this, on the study on violence experienced by older women in Southeast and Eastern Europe. This is a model study that informs about violence against older women in a part of the world where little is known about this. It's an outstanding example of forging productive partnerships among researchers to maximize use of available data, and it expands knowledge about an important social issue that will advance policy, programs, and interventions to protect and empower women of all ages, and in particular, older women, and so that they, if they're experiencing violence, this could enable them to become and to remain safe. Next slide, please. For information on any of the studies I've cited in this presentation or for the reference list, please contact me, and I've got my university email here, brownell@fordham.edu. Thank you very much. And
thank you, Professor Brownell. It is a privilege to have you here because you are an expert in this field, and privileged to work with you in this study. And now, next up is Professor Marija Babović, professor at the Faculty of Philosophy at the Belgrade University, Department of Sociology, and she will present mainly.
Thank you, Natasha, and I hope you hear me. It seems I had slight delay in my connection. I hope the presentation is visible, and thank you very much for inviting me to conduct together with you the analysis and also to present at this conference, because I think it's really very important to focus specifically on violence against older women, as it shows some of very specific characteristics. What will I present today is several aspects of our analysis: prevalence of different forms of violence against older women, who are the perpetrators of violence and what are their characteristics, what are risk factors, what are the main consequences of violence, and how it looks like currently, or actually how it looked like in 2018 when the study was conducted, the reporting help seeking among older women specifically. Some basic information about survey, because I think that it's very important to know about survey and about the subsample of older women. The database that was used for this analysis comes from the OSCE-led survey that was implemented in 2018 in Southeast Europe and Eastern Europe, actually including Albania, Bosnia and Herzegovina, Kosovo, Moldova, Montenegro, North Macedonia, Serbia, and Ukraine. Survey included over 15,000 of women age 18 to 74 years, and we focused in our analysis on some subsample of women old 65 to 74 years, and that included 1,963 women. It is very important to have in mind that this is a narrow category of older women, because women 75 plus were not included, and actually that older women category can really provide a bit different picture on violence against older women, because we know that in that second part of the third age, that later stage with lowering functionality, ground is created for more abuse, neglect, and violent gender-based violence. Here you can see in this graph how it looks, the subsample for each country, and you have something like around 170 subsample in Kosovo and Montenegro, and then the biggest subsample was in Serbia, included 356 women. This is also important to have in mind, because when we want to provide some more detailed analysis on certain aspects by country, this was not possible because of small numbers, and as you will see, especially when it comes to reporting, help-seeking behavior, because those numbers are very small and they go below statistical reliability. So in certain aspects, we could conduct only analysis at regional levels and not to be able to provide a picture for each country. Let's start with prevalence. OSCE-led survey shows that more than half of older women experience some form of gender-based violence since their age of 15 years. And in following parts of the presentation, I will use those two expressions. So lifetime prevalence, that includes experiences since age of 15, and recent experience, this is 12 months preceding the survey. So it's the last year before a survey was conducted. It is very important to have in mind when we receive information about prevalence rates, that the methodology how prevalence was measured was not particularly set for women older than 65. As we know from theory, from many different surveys, that violence changes with the life course, and it takes different forms in early youth, in mature youth period, in middle age period, and then in older age. gender-based violence changes together with life circumstances of women that are related to many different roles they perform, settings in which they live, and norms and values that are also very age sensitive. Cultures prescribe what is acceptable in young age and what in older age. So in taking into account that life course perspective, we can say that methodology for measuring prevalence was more set for women for a reproductive period and not so much for women in older age, because particularly some forms of very specific forms of violence like neglect, economic violence, some perpetrators that are more characteristics for older women are not covered in the same way as it would be if survey would be fully focused on older women. So this is why we see systematically that prevalence rates of violence, gender-based violence against older women is lower when we compare to younger women. But this is something that is partly related to the methodology. Also, if we just check those prevalence rates of any gender-based violence as it is presented in this graph, we can see that there are significant cross-country differences, and cross-country analysis actually shows very important and systematic cross-country differences, which requires also to pay particular attention on national specific characteristics of gender-based violence against older women. But here we could just grasp some basic findings. So you can see there are certain differences with Moldova and Ukraine with highest prevalence rates of any gender-based violence against older women since age of 15. Then you can have some middle level prevalence rates, like over half of women anyway, for Albania, Kosovo, Serbia, and then you can see much lower prevalence rates in Bosnia and Herzegovina on the other hand. We can't explain based on this data what is the background, what is the reason for those cross-country differences, because this is quantitative survey, it provides certain number of data and information, but it doesn't allow for, we can guess and have assumptions, but we can't explain reliably based on existing data what are the reasons for such differences. Now, if we look more into different forms of gender-based violence against older women, we can see that actually, like in younger women, the most prevalent is intimate partner violence. And here we include current partner or previous partner, because some women do not live with current partner. And here you can see that, again, we have differences, firstly, between women of different age groups, and in majority of countries, older women show the lowest prevalence rates when we compare to middle-aged and young women. But also we can see in this left figure, we can see again important cross-country differences with Ukraine and Moldova with highest prevalence rate of intimate partner violence than Albania, and then Kosovo, Serbia, and again Bosnia and Herzegovina with the lowest prevalence rate of intimate partner violence. Then we can also see different forms, prevalence rates of different forms of intimate partner violence. And again, what is very specific for all age groups of women is that psychological violence is the most prevalent. This is the most common form of intimate partner violence, followed by physical violence, and then sexual violence that is disclosed in the least percentages. But what we can see and what we found with this analysis is that patterns slightly are different between younger and older women. While younger women will report in higher proportion than older women experience of psychological violence, older women reported in higher proportion than middle-aged and young women experience of physical violence. So this can provide certain indication that maybe during the life course, or maybe with time changes, with different campaigns, policy measures, maybe the forms of violence slightly change between different generations of women. But of course, this is assumption that cannot be fully confirmed just based on this data. Here you can see also prevalence rates for physical violence committed by current or previous partners, and during the last 12 months and since lifetime, since age of 15. And again, we can see that there are significant cross-country differences, with highest prevalence, more than 1/3 of women living in Moldova experienced since age of 15 physical violence from their partners, current or previous. In Ukraine, it's more than every 4th women. Then Montenegro is close to that, and then lower prevalence rates in other countries. What is also important is to focus on last 12 months prevalence rates, because this indicates, while those lifetime prevalence rate, they indicate what is overall experience of older women. So it's not very specifically revealing the picture of violence against older women. It can be the experience they had in their 20s or 30s, but the last 12 months prevalence rates actually reveal what is their current situation. Of course, also lived previous experience influences a lot well-being in older age. But what is the most important and relevant for actual policies is that last 12 months prevalence rate. Here in second graph, you can see actually the structure, the nature of psychological violence, because it includes several different forms: controlling behavior, abusive behavior, economic exploitation or violence, and the blackmailing with children, which is more specific for younger women or middle-aged women, not so much for older women. But here we have a lifetime experience, so we can see also that certain number of older women reported that kind of psychological violence. And of course, we can see that among women of all ages, the controlling behavior and then abusive behavior are two most common forms of, most prevalent forms of psychological violence, and then to a certain extent less economic violence and blackmailing with children. When we speak about non-partner violence, data indicate a lower prevalence among older women than among women middle-aged and younger women. And here you can also see the prevalence rates comparative for all three age groups. So this is non-partner physical violence, and we can see that younger women and middle-aged women have, but differences are not higher prevalence rates, but differences are not so significant. And then also small differences in experience in last 12 months. And here we have quite actually low disclosure of sexual violence, and there are no statistical differences in regard to sexual violence between women of different age. When it comes to perpetrators, of course, perpetrators of partner violence are partners, current or previous, but we found that there are some partners that bear high risks of of violence against women, older women. And we also compared two characteristics of partners that commit violence against middle-aged or younger women, and there are certain differences. I can't speak in here about more details. You can find it in the study that will soon be published. But what is specific, for example, for older women, it's not very relevant economic status of a partner, because of course partners are usually retired. What is more important is abuse of alcohol, or showing some patterns of aggressive behaviors also outside of the family, outside of intimate relation. Also, we didn't find such a significance of participation of partners in armed conflicts, which is very important predictor of violence among younger and middle-aged women. When it is about perpetrators of non-partner violence, unfortunately, because of relatively small number of women, we couldn't go in more details about different perpetrators by their role, relation to women. They're grouped in certain categories. So you can see here in this figure that actually these are most frequently some friends, acquaintances, some persons that are close to women or neighbors, then relatives, family members, and then somebody that is more distant, somebody that is known to women, but it doesn't belong to their social networks, or somebody that is completely unknown to women, which is the least category. And this goes against that very common prejudice that strangers and unknown persons are the source of danger, but actually it's not like that. It's a partner and then some known persons and then some unknown persons. Perpetrators of sexual harassment are most often men, although we found also that women report, they disclose some experiences in which also women participated in sexual harassment. And when we unpack what is that form of sexual harassment, it seems it's again one assumption that there is certain characteristics in our region. I'm talking now more about Western Balkans, that there are very intrusive questions about private life of women. So this is the form that includes women participation. So there is no some kind of respect of barrier. It's so easy to approach women and then to ask her very intimate questions, which women find embarrassing and harmful. When it is about risk factors, when we studied just subsample of older women, it's the same, like for all women, for younger women, for middle-aged women. The strongest factor that influences their experiences of gender-based violence is childhood violence. So women who disclosed they were abused somehow or violently disciplined during their childhood. In that category of women, the prevalence rate of gender-based violence in adult life are much higher than among women who did not experience any childhood violence. In this figure, you can clearly see the difference that reddish color bar is for women who experienced childhood violence, and purple is for women who did not experience childhood violence. And you can see for example, huge difference in prevalence in the share of women who experienced any partner violence since the age of 15 is huge between those two groups of women. Also, there is difference in partner violence experience during the last 12 months. There are also differences in non-partner violence. So the childhood violence is a very strong factor influencing their later experience of gender-based violence, and that actually this finding points clearly that we have to intervene very early. We have to intervene very seriously in violence against children, and particularly if it has already and when it has those gender-specific forms. Other risk factors include forced or early marriage, women who were married before age of 18, they have higher prevalence rates of intimate partner violence than women who did not marry early. Also, women who did not marry out of their own will but were somehow forced have higher prevalence rates. You can see in this figure, for example, prevalence rate of intimate partner violence among women who choose freely to get married is a bit less than half, while among women who were forced either by their partner or by parents is much higher. Financial and material deprivation is also a very important factor of gender-based violence. And although we want to say that violence occurs in every household, rich or poor, there is certain pressure that comes with poverty, deprivation, frustration coming from lack of sufficient resources to provide normal existence. This is something that increases risks of violence. Economic dependence is very strong predictor, and we know that many older women actually either do not have pension, or their pension is below average pension, or there is the gender gap in pension that is just continuation from gender gap in salaries. So these are risk factors that also increase probability, likelihood of experiencing violence in older age. Disabilities, one more very important factor, and when we conducted the analysis of only on the subsample of women with disabilities from the survey for whole region, that clearly shows, in line with many international studies, that women with disabilities are under high risk. When we take subsample of older women with disability, we can clearly see that they're exposed to much higher risks of partner violence, but we did not find high risks among older women with disabilities of non-partner violence. This can also be related to the specific indicators that are used to measure prevalence of non-partner violence, and we know that older women have a bit specific lifestyle in that age, so they're not so much involved in relations like colleagues, bosses, students, etc. And also, what is important factor are norms and values that are adopted during socialization, that govern our lives, that guide us in decisions, and makes us perceive in different ways our experiences. So we found in the study that actually women who consent with patriarchal values are under high risks of violence. Here you can see, for example, in this table, very briefly, you don't have to now see the details because this requires a bit longer attention, and it's better to pay that attention during the reading report. But you can see, for example, there is attitude: it is important for a man to show his wife partner who is the boss. And then here you have percentages of women who experienced intimate partner violence. So among women who totally agree with this statement, you have more than half that experienced intimate partner violence, while among women who totally disagree with this statement, you have around 40% of women who experience. So there is huge difference. It's much higher share of women who experience partner violence among those who agree with those patriarchal statements. And also here, yes, this is something that I already explained. This is prevalence rates among women with disabilities. There was a question actually that provided a proxy to identify women with disability. Were they restrained from normal activities during the last 6 months? So you have those who were severely limited. We take that as indicator of disability, and those who were limited but not severely. So you can see that prevalence rates are higher among them than among women who were not limited at all in their activity. Consequences include physical, psychological, emotional consequences, and here you can see that most common consequences of the most serious, because survey asked women to elaborate more in details what happened after the most severe incident of violence, partner or non-partner. In this case, I'm showing now consequences of partner violence. So you can see that most common consequences were bruises, scratches, but also certain number of women experienced much more severe physical consequences, including injuries, wounds, internal bleeding, and some consequences that are later on reflected on their sexual and reproductive health, or includes miscarriages. Also here you can see psychological consequences. Most often these are anxiety, difficulties in sleeping, feeling vulnerable, loss of self-confidence, and then some other consequences such as depression, difficulties to establish relationships with others. Every 10th woman also felt for longer period, panic attacks, problems with concentration. So these are all psychological consequences that women mention. And also in this figure, you can see actually how experience of violence influences that health status, that is self-perceived health status. This line is set on percentage of women who did not report any kind of gender-based violence during the survey. So let's say these are women who did not experience any gender-based violence since the age of 15. So among them, almost 1/3 reported of older women reported that have good or very good health. And you can see that among women who experience different forms of violence, this is much lower percentage. It drops below, and it's the lowest actually for women who experienced during the last 12 months non-partner violence. So that health, self-perceived health status is very much influenced by the overall and last 12 months experience of gender-based violence. And finally, what happens, what are the coping strategies of women, how they tackle, how they manage to solve their situation? Do they manage at all? To whom they report, in which percentages, and if they don't report, why they don't report? These are all questions that are answered by the survey. Reporting is overall very small. Survey showed in all countries, among all women of all age categories, but it is very much lower also among older women. So women do not report their most severe experiences of violence. In this figure, we can see that, for example, among women who listed some form of most severe current partner violence, only 4.1 reported it to police, a bit more, 5.5% reported they seek actually for assistance from the hospital, 7% from the doctor. Very low help seeking that is focused on social services, social protection system. It seems to remains quite out of the reporting. Then we have, again, small percentage, but a bit bigger than among than in regard to social services. Women seek help from church or some other faith-based organization, and also very small percentage seeking legal assistance. And this is also something that is quite specific for older women, that very, very low percentage of women that ask for the help to solve their situation of violence. And why they don't report it? The reasons are, by the structure, by the type of reason, quite similar also to younger women. Women usually, majority of women of all ages that didn't report most severe incident of violence think that it's too minor. So that it actually reveals that high tolerance to violence. What is too minor can be also very individual, but they consider it that it's too minor, they can deal it by themselves, it should stay in the family. But also significant portion of women didn't report because of fear, retribution of offender, his family, close persons. Also important percentage was shamed, embarrassed, didn't want, which also tell us about those social environments in which women live, where there is still high stigma or some kind of responsibility placed on women for experienced violence. So they really don't feel, they're reluctant to report it. And then, of course, fear to lose children, they were too upset, and other reasons. And if we think what are the coping strategies, having in mind this kind of data, actually we see that majority of women do not have coping strategy. Actually, the coping strategy is just to learn to live with that kind of violence. We don't see from this data indications of clear exit strategies, which is very concerning, and particularly when it comes to older women, having in mind all other structural factors, living conditions, well-being, and available services, we should be very concerned what is available to these women as exit strategy, and which is actually the only successful coping strategy. So, of course, much more details and more findings you can find in the report. These were just some of the main findings, and I'm sorry if I took too much time. Thank you.
Thank you to Professor Babovic. Now I will give you a recommendation. Considering this is a regional research study, the recommendation we provide are general, not specific to this region only, and are applicable to everywhere. And the recommendation will be summarized of what all panelists said during this conference. And we have several groups of recommendation: data collection, regulation, services, education, changing social norms through advocacy. First of all, cutoff age for data collection must be abandoned. We need more research on violence against older women in order to gain better insights into the specific of both types of violence, as neglect, financial violence, and perpetrators as the grandchildren, children, or family caregivers. The research would allow us to find out how the aging process affects existing relation, primarily within a family, but also in a society in general. Also, this research would help us to identify particularly vulnerable groups in the population of women, taking into account intersectionality, such as rural women, women diagnostic with dementia, older women of different education level, ethnic health status, or sexual orientation. We need studies on gender-based violence in the general female population, needs to include older women, by reflection the whole population of women regardless of age, as well as by asking questions about specific forms of violence affect older women. Furthermore, regular official statistics surveys such as FRA and corresponding survey in non-EU member states should include specific indicators for older women, and the sample should include women over the age 65 without limitation at the age 74. Data collected with the different protection systems, social protection, health protection, police, must be age disaggregated into a 5 years cohort, as well as gender categories, and of course must be publicly available. When we speak about regulation, existing regulation relevant to domestic violence should recognize violence, should recognize older women as an at risk group. Violent and abusive act against older women should take as taken as aggregation circumstances during trials process. And in the light of COVID pandemic, public policy should also reflect the position of older women during emergency, provide an adequate response to their needs in the event of disaster, crisis, and emergencies. Then third recommendation, services, ensure access to information on prevention and protection services for older women targeted by violence. Availability of information in place, the use of different channels of communication. Ensure that availability of free legal aid services, SOS telephone number for older women, safe houses should be adapted to the needs of older women as well. Long-term care service providers should build their capacity to be able to screen for risk of violence and inform women about available support services or to refer them to the system for protection. This would include additional protocols of home visiting nursing and home care professionals. On the top of that, continuous work at building and improve soft skills of service providers should be done to enable them to work with older women more efficiently so they can provide adequate approach and use adequate communication means. Then provide support services of informal caregivers in order to reduce the burden of care and reduce risk of violence. Then mental health and psychosocial support services should be trauma focused. They can provide adequate support to older women survivors of violence. Education. Training to identify signs of abuse, neglect, and violence against older women should be part of the curriculum at college that prepares staff to work in institutions and services that deal with the prevention and reduce consequences of abuse. Professionals working in such institutions and services should have continued training on the prevention of violence against older women, which should include both knowledge of administrative and legal framework, as well as communication and psychological support skills for working with survivors of violence, adopting a trauma-focused approach. Such training should reflect intersectionality approach. To see poor older women, functional dependent women, women who suffer of dementia, or Roma women. At the local level, it is necessary to have regularly organized joint training and information session for professionals who work with older person, and continuing information session with older women at community level, how to recognize violence, to know how to report, and how to system protect older women from the violence. And then last but not least, part of the recommendation is changing social norms through advocacy. Promote a positive image of contribution of older women. That's crucial. Plan of long-term care, continuous work on the fight against stereotypes about older women. Ageism is a widespread form of prejudice and discrimination and affects the population of many levels, from affecting the physical and mental health of older person to influence policymaker by ignore, among other things, the heterogeneous nature of older population. The media amplify these stereotypes, so it's necessary to work with media and with them to recognize that the protection discourses in which older persons are group that must be protected and preserved at all costs, and in paternalism and affect the decision maker power of older women. Then we need to invest in prevent measures during the life course, promote intergenerational solidarity as part as the implementation of strategy for achieve the sustainable development goals, which states should recognize older women as one of the social group that should be included and no left behind approach. And in the end, promote and adopt the United Nations new convention on the rights of older persons at the global level to ensure that rights of older persons are recognized and supported in all contexts, which will help the system and society to recognize the risk of violence of older persons and older women, and ensure that older women are better protected from violence and more willing to report it when it's occurred. And we need more solidarity between women, because we need to be assured that human rights of older women today, it's human rights of young women tomorrow. And thank you very much. This is our contact information. And now we have Susan Somers, who she will say something about way forward. Susan is the president of International Network of Prevention of Elder Abuse. Floor is yours, Susan.
Thank you very much, Natasha. That was an excellent overview of all the recommendations that came from this very important project on data of violence against older women. And thank you is, the least word I can use for doing this project. For UNFPA for recognizing the importance of following through and paying attention to the issue of violence against older women and supporting this data research, and to the OSCE for allowing the use of their important data, and of course to Pat Brownell for all her consulting and support, and our good friends and INPEA members from the Red Cross Serbia. Some of you may know that Natasha is our regional representative to Europe for INPEA, and we rely very much upon her skills and her very hard work as we go forward. And in the context of INPEA, we have during this terrible era of the COVID pandemic, we have tried to go forward in this era of great disruption, suffering, and uncertainty. But we find that there's also an opportunity for hope, and projects as presented today make that clear that there is hope. I'd just like to highlight a bit the work that INPEA is doing to promote the international network of older women advocates around the world, to share data and best practices. We try to get the data out to a global audience through our INPEA network, and we encourage others to focus on older women and abuse. We try to work, of course, through UN Women and CSW. The various NGO committees on aging are also supportive in this area. We try to network with domestic violence and other interest groups to incorporate older women and widows into the research projects and intervention programs. We work to raise awareness of the need to include older women in research, practice, and advocacy agendas globally. And during COVID, and in light of the urgent need for a global response, INPEA established bi-weekly Zoom meetings where all friends and members of INPEA were invited to come and discuss some of the urgent issues that they had, some of the common problems they were facing, and We also did a survey on the issues that our members were seeing during the early COVID period. And we tried to provide not just moral support, but other types of documentary support and other types of data support. As a result of the pandemic, we saw older women had been particularly affected and identified by the UN Secretary General in his policy brief in May of 2020, some time ago, and not much has changed. Older women, what we found, were being kept like prisoners in their rooms in nursing and care homes. They had little human contact, and their carers also lacked adequate protective equipment. And as reported and just earlier said by UNFPA and others, they reported that violence and abuse had increased when couples remained isolated in homes for weeks on end, and months, obviously, sometimes, simply because of their age. The increase in the number of widows resulted in, for many, in loneliness, isolation, and poverty. And this was part of a statement that was given by Elizabeth Schlater of the Older Women's Network Europe, with whom we also collaborate. And this was during the Open-Ended Working Group on Aging, last year's program, the 11th session, which it's over a decade of endless discussion and little action with the Open-Ended Working Group on Aging. One of the outcomes that came from this, this bi-weekly discussion was that we promoted this networking and linking researchers and practitioners in the field. And some interesting issues came up, such as Pat Brownell suggested that we start to look at trauma and recommended that training and service programs incorporate a trauma-focused approach for serving older women victims of violence. An example is that we have a curriculum from a New York State agency, which we can share for those who are interested. We try to work through different vehicles, through substantive bodies at the UN, WHO, ILO, etc. And we try to incorporate the issue of older women and violence in the SDGs. But we find, that we're left a bit lonely, as we see in the UN Secretary General's Common Agenda. Very little or anything focuses on older women at all, but certainly not on violence against older women. And UN Women also has left us out in the cold once again. I'm not quite sure but why this is happening. But again, in their projected agenda and policy, older women are left out. And I see that Sylvia Carol Levin has very capably set in the chat, if you'll see the link to that project that excludes older women, for your information. So we're coming up to the 12th Open-Ended Working Group on Aging, and we want to work, of course, towards a new convention to protect the rights of older women and men, and to ensure that age discrimination is prohibited in law, and bring policy and services into focus on violence against older women and widows. And we have to give our thanks. In closing, I would like to thank Ms. Claudia Mailer, the independent expert, who's working to ensure the voice and contribution of older women are heard and included in the human rights discourse. We have a friend there. And as expressed by Dr. Pat Brownell, INPEA's North American board member, who consulted on this project, this project research meets the gold standard, and it will be of enormous value to ensure that violence against older women can no longer be ignored. We are in debt to Professor Maria Babovic and Natasha Todorovic, INPEA regional rep for the European area, and to UNFPA for recognizing the importance of promoting data on violence against women and all involved in this project. Thank you.
Thank you, Susan. Now that's and this is for our presentation today. I need to answer a few questions. First question: everyone who attend this conference will receive presentation and will receive whole study of the research, not only presentation. presentation will receive tomorrow and study will receive during the January. That's one of the questions. We have, yes, and people from not only from Europe, people from Africa. Stefan Wander asked about presentation. And then we have one question from Amal Abul Rafal, she's focal point on aging on United Nations in New York. She thanks so much for the noting that we said that chronological age does not reflect the reality of violence against older women, and wonder if panel experts could kindly reflect from their experience, project, and or research on what they think are the associated challenge of using traditional data to measure the situation of older people and violence. And second question is the impact, the implication for better data needed for policy making on this issue. That's a question from Amal. In my perspective, it's a challenge when you have some research and extract the data. Sometimes you want to see more than you have in data. And as we said about collecting the data, it's crucial to do together. To cut off for data collection must be abounded if we want to know something, especially if we want to know something about violence against older women. We need better data, and we need to advocacy together for our governments to collect data, because we will protect better older women if we know forms of the violence, if we know the circumstances they live. Maybe someone else wants to answer this Amal's question. Patricia?
Yes, thank you, Amal, for that question. And I think one of the values, one of the challenges and opportunities, if we use the Madrid language of promoting more empowerment in older age, is with the tradition of the classic violence against women studies. And we talked a little bit about some of the challenges, because they don't typically, and the OSCE study is certainly an exception, they don't typically include older women as part of the sample. And they don't always include the questions that are relevant to older women, but they do allow for a comparison among different age cohorts in relation to violence experience, the type of violence, and the effects of violence. And I think that's one of the things that makes this study so valuable, is that it does allow for correlations among, for example, child abuse and elder abuse between younger and older women. And I think more studies like this could really help us understand globally the impact and commonalities and differences among violence across the lifespan for younger and older women. So, thank you for that question.
Okay, thank you all. Thank to all participants. Special thanks to all panelists, special Susan and Pat, because it's a early in the morning in New York. And special thanks, of course, to Claudia Mahler. And thanks to UNFPA, thank to OSCE. And we hope we will move something we will move something with this research, and we will move something with the future research. And I think Borka wants to say something or not?
No, I just sent a thank you note to the chat. Thank you, everyone.
Okay, thank you very much, and we will send you study and presentation. Thank you, and thank you, Maria. Of course, I forgot you. Thank you, special thanks to you.
Thank you, thank you all.
Bye.
Bye.